Okay. All right. Thank you, Holly. All right. So we have been talking since end of February, beginning of March, going through different stages of this, and we've, as everybody knows, we're hanging in with you until there's an actual vaccine, because information is always moving and changing. So right now, we're talking about how to lower your risk during reopening, and for those of you who don't know me, I'm an emergency medicine physician, and I've been an emergency medicine physician now for about 25 years. And I've worked in, this is my third or fourth pandemic. So with the previous ones being TB, malaria, HIV, and now COVID-19. We have a website set up, which is AskDrV.us. So a lot of the research and articles are actually referenced on that website, as well as a Twitter page. All right, so the structure is that we're going to have a presentation. It'll be a little bit longer than 10 to 15 minutes because there's a lot of new information. And there were a lot of things that came up from our Q&A from last week that I went back and researched and added to this. And then we'll have another Q&A for about 30 minutes. If you want to ask questions, you can put them in the Q&A, or you can actually put them in the chat box. Depending upon the number of people, we will also possibly raise hand and unmute people, just as long as people don't have a lot of background noise. All right, so the purpose of this is to keep you informed of COVID-19 science as we go along, so you can keep yourself and your family healthy during this pandemic. You'll be motivated to leave out of this webinar creating an action plan for yourself and your family. Maybe you have an action plan, you may decide to adjust it, and you may also be looking at an action plan for your broader community or neighborhood. All right, so what we're seeing now is large variations in COVID-19 infections by state. So we are having hotspots arise, which are primarily Arizona, Florida, South Carolina, Arkansas, North Carolina. The other one to add in there is Texas. And then we're also seeing, so these places are double and triple digit increases. So 100% increase means you're essentially almost doubling your caseload in a matter of a day or two. In 18 states, we are seeing decreases in COVID-19 cases. So those are Minnesota, New York, Virginia, Michigan, Colorado, etc. So the way that our country is responding to this is actually very different from state to state. And I think it's important, if you have family members that are in the hot spots, that you be the one to educate them or get them on this webinar. So there's a lot of stuff about COVID-19 and nutrition, specifically zinc and vitamin D deficiency. So I want to go into a little bit about how these things impact your immune system, how they strengthen your immune system, and what sort of things you can do. So basically, there's a lot of different types of vitamin D. There's D1, D2, D3, D4, D5. Normally you see in the drugstore either D2 or D3. The one that you actually want, and the one that is most important for what we're speaking of, is actually D3. Okay, so I don't want anybody to get confused when they go into the GNC. The one that we're actually talking about is D3, and that is the one that is associated with sunlight. Okay, so that is the one that is most protective of your immune system and also of infections. So the Institute of Medicine has a recommendation of how much vitamin D you should take in a day. Basically, if you're 90 to 70 years old, you should have 600 international units a day with a maximum of 4,000. If you're over 70 years old, you need to have 800 international units a day with the max also of 4,000. So the older you are, the more vitamin D you actually need. So as you can see here, they're studying at Northwest University that vitamin D levels appear to play a significant role in COVID-19 mortality rates. And basically, vitamin D strengthens your innate immunity, and it prevents an overreactive immune response. And you know, children and young people have a very good vitamin D level, and that may play a role why children and younger people are less likely to die from COVID-19. There's specifically a clinical trial going on now that is a randomized controlled trial with high dose vitamin D3 and standard dose vitamin D3, and looking at it for patients that are at high risk for COVID-19. Now, where can you get vitamin D? So 30 minutes of sun twice a week without sunscreen is how you would normally get vitamin D3. We don't actually recommend that people actually not use sunscreen. So when you go out into the sun and you have sunscreen on, whether it's your makeup or actually just a sunscreen lotion, you would need more than 30 minutes twice a day. So I normally tell people if they do an hour of walking, in nature or something 3 times a week, that's usually sufficient. But you can see that you could be very deficient of vitamin D if, for instance, you work the night shift. And so you're primarily moving around at night. So food sources of vitamin D, salmon, mackerel, beef and calf liver, mushrooms, cod liver oil, sardines canned with oil, and tuna canned with water, egg yolks, and cheese. Also, the United States, along with many European countries and Iran, fortify some of their foods with vitamin D because we are more likely to have a vitamin D deficiency. And so some of the foods that are fortified with vitamin D, it'll say on the label, like milk, orange juice, yogurt, margarine, a lot of breakfast cereals. And then we just have the levels of vitamin D supplementation. All right, so now some people discussed it the last time, well, what if I'm on other medications? How does that affect things? So if you are on weight loss medicine like Zenical or Ally, or if you're on cholesterol lowering medications, these are things that will decrease your level of vitamin D and make it more likely that you need supplementation, right? Statin drugs or thiazide diuretics, which are used for high blood pressure, these are things which will increase your vitamin D, and you're less likely to need vitamin D supplementation. You should avoid taking vitamin D if you're on any type of seizure medication. Now, some people will ask, how do I know if I'm vitamin D deficient or not? You won't really know unless you actually get tested. There are some symptoms of vitamin D deficiency. If you've ever broken a bone, or you break bones easily, or if you break a bone and it doesn't heal very well and you constantly have to go back, or it constantly re-breaks. These are things that are associated with vitamin D deficiency. But everyone in general can take 1,000 international units a day, right? You're not going to overdose on vitamin D with just 1,000 international units a day, and you'll keep yourself in a safe zone. This was another study, and as you'll see, this study was actually from 2017. So this was before COVID-19, and I only bring up this article because vitamin D supplementation helps with any sort of respiratory disease. So influenza, RSV, asthma, any sort of respiratory infection, vitamin D assists with. Now, if we go on with to talk about zinc, this is a study that's currently being done at Cleveland Clinic. And they're actually looking, and they're specifically using zinc gluconate, and ascorbic acid is vitamin C. So they're using vitamin C and zinc. The studies of this have not actually come back yet. But zinc actually does, zinc also has been found to be associated with people who actually do better with COVID-19 when they have normal or normal zinc levels. And if they have lower zinc levels, they have been found to not do as well. The World Health Organization reported that zinc deficiency was responsible for about 13% of all lower respiratory tract infections. So people were asking last time, when can anybody take zinc? So don't take zinc if you're on cisplatin, which is a chemotherapy for cancer, or amiloride, which is for high blood pressure. Now, zinc can make certain antibiotics less effective, and they can also make certain NSAIDs or Motrin, naproxen, make those sorts of drugs less effective. If you are on any of these medications, these medications decrease your zinc level. So ACE inhibitors and thiazides are both categories of medications that are used for high blood pressure. So when you look at the fact that African Americans don't do as well with COVID-19 and we're more likely to die, more of us are on these medications. We're more likely to be on ACE inhibitors and we're more likely to be on thiazide medications. We also are more likely to be in a profession where we may be working the night shift. So between these medications and working the night shift and sun exposure, zinc levels could be a major problem. Recently, we've been seeing more symptoms associated with hearing loss, and the hearing loss seems to be an overlooked symptom of COVID-19, particularly in younger people. It can occur with respiratory symptoms or without respiratory symptoms. This was just in today's hearing where Dr. Fauci was asked about using masks earlier. And in this interaction, he actually, admitted that they didn't come out with a recommendation to use masks earlier because they didn't want to actually decrease the supply of masks for healthcare workers. Those of you who've been on this call intermittently know that we started calling for mask usage probably about 6 weeks before the CDC did. Now, this was also something that happened. I actually told people that people are going to start falling out. So D.L. Hewley fell out and then was found to be COVID-19 positive. This was a Zanies comedy club, which was in Nashville. Now, I don't know about other people that are on this call, but we are not even allowing these types of performances to actually occur. Any sort of indoor performances, whether or not it's theater, or comedy or music are not allowed in Washington, D.C. And as you notice, I actually put this slide in here because as you notice off to the right, the people in the audience, no one has on a mask, right? So no one, and this was actually in Nashville, Tennessee. So you really want to make sure in these areas where, in these states where they are not necessarily abiding by the best guidelines, and if you have family members in this area, that you share with them to avoid these types of activities. Blood type, I'm just reiterating this. People with A blood type are more likely to have a severe COVID-19, where those people with blood type O are more likely to have a less severe episode of COVID-19 if they actually become infected. Some people don't know their blood type. Your blood type O, if you've been told that you can donate blood to anybody. And you would know that because usually the blood bank people are calling you all the time. So if the blood bank people are calling you all the time, you are most likely a blood type O. Now, we had there was an article in the British Journal of Psychology talking about who are the type of people who ignore lockdown restrictions and mask requirements. And they are more likely to be part of what we call the dark triad, which is narcissism with an inflated sense of importance, deep need for excessive attention and admiration, Machiavellianism, which is a personality type where they're sort of manipulative, deceitful, sort of the end justifies the means. Any way I get there, as long as I kind of get what I want. Or psychopathy, which is impaired empathy and remorse and some disinhibition. This sort of dark triad is more prevalent in people who ignore lockdown restrictions and actually ignore mask usage. Now, to wear a mask or not wear a mask, we wanted to talk briefly about the transmission probability. The person to the left is unknown. She doesn't know it, but she's a COVID-19 carrier. So she's D.L. Hewley before he fell out on the stage. And the person on the right is the healthy person. So if the person that has COVID-19 on the left does not have on a mask, and the healthy person has on a mask, the likelihood of transmission with close contact is 70%. If, on the other hand, the person who has COVID-19 has on a mask, and the healthy person does not have on a mask, then the likelihood of transmission is 5%. If both people have on a mask, then the likelihood of transmission is 1.5%. So you can see how the probability goes down dramatically with wearing a mask. It's very important. You're saving yourself as well as other people in your community. We talked a little bit about all different types of masks. You know, the basic surgical mask is that is not in these pictures is about 60% effective. If 60% of the people wear 60% effective mask, then we would actually pretty rapidly get control of this infection. The other masks that you have are the N95 or the KN95 mask, which is off here to the right. That mask actually blocks 95% of the particulate matter rather than 60%. And that blocks 95% when it's actually fit tested to you. Most people don't have it fit tested to you. So maybe it's 90 rather than 95, but it's in that range. The Spirion half respirator mask, which is a silicone mask that is off to the left, that actually has, it's much easier to breathe in that mask, even though it looks like a little bit more of a contraption, but that blocks 100% of the particulate. So I actually recommend the mask to the left if you have to fly. It's very, very important, as we'll hopefully see a little bit later. All right, 6 essentials for the mask is that they should at least have 3 layers. 4 layers is even better. You can add a coffee filter or some sort of carbon filter, that's even better. It needs to fit around your nose and chin. And you need to pull it away from your face without touching the outside of the mask. So most people touch the outside of the mask right by their nose or mouth and then yank the thing down. So you want to actually, instead, actually take your mask off by the strap, because the outside of the mask is actually dirty, right? And then washing it after every use. All right, so we're going to show a couple simulations. So the first one here is an office setting, and this actually shows what does it look like with someone who has COVID-19 and is in an air-conditioned workspace. And I'm just going to show it. Now what it's going to do is it's going to look at it from the top, so you can actually see where all the particles actually land. And you see why shoes and tabletops, computer, keyboards. Now it actually shows what happens if he actually coughs into his arm and how it doesn't quite go as far. All right, then the next simulation is going to be like if you're in a library, like, you know, where there might be bookshelves, stacks of bookshelves. I know for our public library, they're not allowing people to go into the stacks. And this actually has a time minute at the top, and it shows 1 through 6 minutes. Okay, great. All right, now we're going to show an airplane. An airplane, you know, has recirculated air. So this actually shows someone in the middle of the airplane who is COVID-19 positive, and then it actually shows you who on the plane actually gets infected. So the person in the middle in the blue is the one who's COVID-19 positive. And this is simulating recirculated air that you often see on the plane. And the light purple are the ones who get enough of a viral load such that they actually become COVID positive. Okay. All right. So lastly, we want to talk about the vaccines and where are the vaccines in the various process. So there's different steps in the vaccine process. The exploratory process, which is just how does the infection work? Preclinical, where they test it in animals. And then clinical development, which is phase 1, where they do it to a small group. They give the vaccine to a small group of people, and they determine if it's safe. And then phase 2, they give it to an increased number of people to see if it actually works. And then phase 3 actually deals with efficacy and safety, and it's given to thousands of people. Then they do a regulatory review and approval. Then there's manufacturing of the vaccine, and then quality control, and then actual distribution. So with this COVID-19, because this is the same sort of a virus as the SARS vaccine, we had already done exploratory phase and preclinical. And in Asia, they had actually even started on phase 1. So that is how come with this particular vaccine, it's able to move a little bit faster than we would have normally. So when you look at the type of vaccines that there are, there's various different vaccines. There's a total of about 80 that are under development. And some of them are in exploratory, and some of them are in preclinical, and some of them are in a clinical phase. The one that is furthest along is the one by Moderna at the top there, and then also CanSino. Both of those are getting ready to go into their phase 2. So they're going to go into phase 3 in July. They're in phase 2 now. So Moderna said that they will have manufactured enough vaccines to go into phase 3. They're going to start sometime in July. They have to recruit 20 to 30,000 patients for this vaccine. It's a 2-part vaccine, so they have to give the vaccine once and then give it again in 3 weeks. So that's why this is going to take a while before we actually see the results. I was actually on a webinar with NIAID with Dr. Fauci this week, and one of the speakers actually suggested that they think that the October surprise is going to be that Trump is going to say that the vaccine is approved before it's completely gone through all of his clinical trials. So they said that blatantly. So again, we have to watch this and make sure that it actually goes through every phase before we run out and go get it. The other thing that they found is that steroids help reduce the risk of some of the sickest patients from COVID-19, specifically dexamethasone, given for about 10 days. Then lastly, under 21, they're about half as likely to catch COVID-19 as older people. And again, we do believe that this could possibly be related to zinc and vitamin D levels. All right, so with that, I want to turn it over to Q&A.
Okay, and we have a full house, so I will remind people the different ways in which they can ask questions. We
Yes.
have both in the chat, and we will answer those questions live. And you can also do the Q&A, and we'll take those questions first. And then if we have a little time, we'll take a few hand raises. But we'd like to take the written questions first, and then the chat. And then if we have time at the end, we'll see if we can get more information from people. So we are off to the races. Dr. V, thank you for that presentation tonight. It was so many good things in it, and a lot of
welcome. You are welcome. I'm just getting myself something to drink because I had new slides and a lot longer, so I'm just getting myself something to drink.
Yeah.
All right, but
so we have, and I know we'll have some good questions. So let's start with why does blood pressure medicine reduce your need for vitamin D?
Okay, so it doesn't reduce your need. it reduces the concentration.
Mm.
Right, so I want to make sure. So what it's doing is it's decreasing the concentration, and it's also decreasing the decreasing the zinc levels. It impacts the zinc levels more than the vitamin D levels, and that's most likely because a lot of the blood pressure medications are diuretics, and when you're excreting more, you're excreting more zinc as well. Mm-hmm. So it has more of an impact on zinc than vitamin D, but the need of your body is the same.
Are there other medications that have that impact on zinc and vitamin D that we should be aware of? Things that we maybe are taking regularly?
Yeah. So, you got me right where we stopped with the slides. So my assistant and I were. So we were working feverishly on the entire list.
Yeah.
And so what we're going to do is we're going to finish the entire list tomorrow. And I'm going to make sure that we put it on the website.
Okay.
So that everybody knows these are the medications that will decrease your zinc levels. These are the medications that will decrease your vitamin D levels. Everybody will have all the information on the website. So we were working on that feverishly. But as you can see, I just wanted to kind of show, we have an increased incidence of hypertension in our community, and we're on a lot of these medications. And so it's no wonder that we would then not do well with something. So I think it's very important for people to take some zinc supplementation and vitamin D supplementation.
Awesome. And then thank you very much. Very informative and helpful from L. Springer Pepper. Thank you. We appreciate it. We hope you stick with us to get even more information on Tuesdays and Thursdays. And then a question from Elena. That's Alana. I hope I'm saying that right. Do the majority of African Americans have O poor type?
No, she's talking about the blood type.
I think so. Yes.
She must be talking about the blood type. No. So so type O does better with COVID-19, and type A does worse with COVID-19.
Mm.
We are not more likely to have either one of those blood types. So African Americans are more likely to be blood type B. So we have a higher incidence of being blood type B. I could actually add a slide that actually includes ethnicity. But yeah, we do not, we're not more likely to have A or O.
Okay, thank you. Oh yeah, she was talking about blood. Perfect.
Yeah, no, and that's how come I think that zinc is really, what we're seeing is, I think, differences around zinc and vitamin D.
Perfect. So your slides, will your slides be available to those on the call? You do this, you put this on your website, correct? The presentation?
Correct, yeah. So the updated presentation, which is always dated, is on the website. And so what we do is we record the presentation, not including this Q&A, because obviously the Q&A is, for people to be able to privately ask whatever they want. So we cut this tape down to just the presentation, and then we put it on the website.
Okay, and that website is AskDrV.us, so you can check out the slides there. All righty, this is the best presentation yet. Yay from Priscilla. High praise. And they just keep getting better. Why isn't the first COVID wave over?
Because we haven't done what we need to do. We're not doing the testing. We're not doing the contract tracing. So let me tell you so I think it'd be important. What would this look like if we had actually done what we needed to do? Okay. So first of all, you would test everyone with symptoms, whether or not they needed hospitalization or not. You would set up COVID hospitals so that your regular hospitals could continue doing the elective surgeries and continue doing their normal course of business, because hospitals are losing tons of money, right? I was on the webinar that I was on with NIAD. Henry Ford Hospital System said they expect to lose 1.6 billion with a B dollars by December. They've already lost 700 million, right? So you'd keep all of your hospitals functioning as normal. You would have rapid testing, quickly figure out in the triage areas who's COVID positive and who's not, and then send the COVID positive people to the COVID hospitals. Mm-hmm. Okay. So then your hospitals normally function. Then you would go out into the community and you would test asymptomatic people. You could either test asymptomatic people, or you could actually test the sewage system, because we also excrete COVID-19 in urine and stool. And that would tell you what neighborhoods are the hotspots. So once you determine what neighborhoods are the hotspots, then you go in there and test almost everybody in those particular hotspot areas. And then you actually isolate those people. Some people cannot be isolated because they're in a household where, you know, there could be, you know, 4 people that live in a 2-bedroom, 2-bath house or something. You know, they live in a very small house. So then you would take those people that need to be isolated, and you would actually rent out hotel rooms and actually isolate people that are not able to physically isolate in their homes. That's what you would actually do to actually do this. And then have contract tracers, right? And you have to have a couple hundred contract tracers in a state, in a regular size state. So right now, the state of Arizona has like 6 or 8 contract tracers. They have less than 10 contract tracers in the whole state. You can't manage a pandemic like that.
So if we're not through the first wave, how are we going to know when we hit the second wave?
Well, interestingly, we're just probably, you know, so one of the CDC directors said it's just going to be like a fire that's burning continually.
Oh.
Right. So some states may actually experience a decrease and then an increase, like New York is really, really going down. New Jersey is really going down. So some states may actually experience like a decrease and then another increase. But some of these states that are not doing what they're supposed to do, I don't think they're going to necessarily see a decrease. They're going to just go straight on through.
Mm-hmm. Okay. All right. Let's see if we have any other questions here. And folks, Priscilla, let's see. Did you need to unmute yourself? Oh, wait, hold on one second before we do that.
Okay.
Can you explain? All right, Danielle Smith, we'll try to get it. She said, can you explain this to the Trump administration? And I would add to that. I'm sorry, I laughed when I read it. Yeah, we want to do that. I think the other thing here is, you know, I feel as though this is a very unique time because it feels like there's a lot of different opinions from different medical professionals, and it seems like the CDC guidance is not as strong as what it might normally be. Is politics getting in the way of our health care policy?
You know, the CDC normally has actually been able to, in the past, give medical guidance without political pressures. And we are seeing some CDC guidance, I think, bow to political pressures. Even the guidance around going to church, particularly, it is extremely dangerous to be in a church with someone singing. And the original CDC guidance came out that way, and they were asked to change it. I think maybe you might have seen in the news where there was one set of CDC guidance, and then there was what was actually released. And what was released was a lot weaker. That was part of the reason that made me start these webinars, because I wanted people to realize that you can't just, I mean, look at how long we were saying wear mask on this webinar, and the CDC was saying we don't need to wear masks. It was at least a month, right?
Yeah.
Right. And so, you know, I think that, you know, you have to, it's being watered down because of politics. And you can't just, if you're doing the minimum that the CDC is actually asking you to do, that's inadequate.
Yeah. How long at this rate will the virus last? That's from Alana.
Yeah, so in order to get, you know, so the virus is going to last for a very long time until, it depends on when the vaccine comes out. So when the vaccine comes out, in order to get what we call community or herd immunity, we have to get about 60 to 70% of the population vaccinated. So if we're 300 million people, you know, we have to get at least, 180 to 200 million people vaccinated. And then we will actually, you know, experience a real slowdown in this. So, you know, I'm thinking that it's going to be the end of 2021, maybe the beginning of 2022.
All right, from Danielle, you are so good, and I don't know why other than trying to save their economy. It's bad information all over the place. We promote you to the lead COVID-19 advisor from Danielle. We will wait for you to let us know when to take the vaccine for sure.
Yes. Let me just say something, because I think it's very interesting. Like, if you look at what New Zealand did, New Zealand completely shut down. They put in all of the public health measures that we discussed, the contract tracers, the government helped you if you couldn't quarantine. They did everything. And they are now, as a country, COVID-19 free. If you fly into their country, you're going to get a COVID test. You're not just going to get a temperature check. They were able to reopen their economy. So it's like a lot of things in life. Like, you really have to do it and do it right, and then you don't have to do it for as long. But if you don't do it right and you do it kind of sloppily, then you've made the sacrifice, but you actually never saw the benefit.
Mm-hmm. Without getting political, from Priscilla, but you might have to answer this question. Do you see a pattern where the ignorance of science is intentional? In other words, do you see an underlying pattern to why this disease has been allowed to run rampant?
Yeah, so we have seen in medicine where diseases that impact African Americans are treated differently than diseases that impact, the majority or Caucasians. So one of the starkest contrasts that we saw was with crack cocaine addiction versus opioid addiction, right? Opioid addiction is, we should be compassionate. They need treatment. Crack cocaine was criminalized, right? And so, there is a lot, there is a lot of concern in the medical community that, has this been ignored for some racial reasons. Holly, you there? Holly, did I lose you? We cannot hear Holly. Hold on just a second. Let me see. Okay, are there any more questions in the Q&A? Okay, great. I'm listening. I'm looking at the chat here. All right. Any more questions in the chat? No? All right. We've got another question on the Q&A. When in an airplane travel, you're wearing an N95 mask as a 95% effective device, but COVID is in the air landing on our clothes and surroundings. Are we still likely to catch it, possibly explaining why we cannot get rid of this, transferring to others, especially the ones we're close to? Yes. So if you are flying, you should actually be using a Tyvek hazmat suit. So when I've talked to people about flying, first of all, I wouldn't fly. But if you have to fly, and you must fly, I would fly using a Tyvek hazmat suit. You can buy them on eBay. They're about, I would say maybe $18 or $19. They come with shoe coverings attached, so they have like footies in them, and they also come with a covering for your head. How are you? And I would suggest getting the N100 respirator mask that I showed you. That is about $70. So if I were going to fly, I would make that $90 investment and actually fly with those items as well as some gloves.
Mm-hmm. I lost the chat thread, so I can't see if there's another question. I'm sorry, I got disconnected for a moment.
That's fine. Yeah, that's fine. No, I do not see any other questions in the chat.
Well, I will say that the I am flying maybe, and I hazmat suit. And right. I tried it on with the hood and everything to try to figure out which clothing to wear.
Oh my gosh! Wait a second. I got another question in the chat box.
Yes.
When can we go to the Vegas casinos? No.
That's that's ruining my day too, because I
Yeah.
Vegas.
You know, now I'm to tell you, if you want to go to their pools, if they're having blackjack outdoors, you know, it's interesting. You know, I am
They've been
kind of,
spending a lot of money on these casinos though to try to get them COVID ready. You still don't think so though?
no, I wouldn't. The issue is that they're indoors, and they're also in a state that is not requiring masks, right? So the photos that I've seen of the casinos, there seem to be a lot of patrons walking around without mask on. So as soon as you do mask, and as soon as you have people walking around without masks, and you have an indoor facility with no windows, so it's totally recirculated air, it's gonna be problematic. I would not do. I personally would not do a casino.
We have another question. In light of current pandemic, what advice would you give a Black person who has a blood type A positive, who drives a public bus for a living? And then what precautions should they make? And thank you in
Okay.
advance from Leona. Thank you, Leona, for your question.
Yeah. So I would make sure that I am on zinc and vitamin D. I would probably be wearing an N100 mask when I go to work every day, and gloves. When I get home from work, if I don't have on the Tyvek hazmat suit can be kind of hot. So if you actually, you know, if you're not doing that and wearing that every day, then just make sure that you're wearing some sort of clothes that you can take off as soon as you get home and sort of throw in a washing machine. And you know, not go home and actually begin to sit on your sofa with your work clothes on, or get in your bed with your work clothes on, or sit in your dining room table with your work clothes off. You want to get those work clothes off completely, including socks and shoes.
Mhm. Okay. Dr. Fauci, big fan, said that he saw a vaccine possibly ready for early 2021. You
Yeah.
mentioned a different timeline or time frame. Which vaccine are you referring to? Which one is Dr. Fauci possibly referring to?
Oh no, we're referring to the same thing. So when the vaccine becomes ready, let's say first quarter of 2021, I think the end of 20 or 2021. The reason why I said the end of 1921 and into 2022 is you have to get 160 to 200 million people vaccinated before you have herd immunity. So the question was, when will this stop going around, or when will this end, is what the person asked. So what happens when you have a new vaccine is the first people who are going to actually be immunized are all essential workers. So everyone the person who actually drives the public bus, and all the transit folks, all of the people who work in the food industry, and all the healthcare workers. And then also you're probably going to get the high risk people immunized, who are going to be those with asthma, emphysema, risk factors, and greater than 65, 70 years old, right? That alone is not going to stop the transmission of this disease, right? You're still going to have everyday folks getting this disease, right? So when we're actually really going to see it stop is when we actually get 60 to 70% of the people in this country immunized. So that is, like I said, with 300 million people, that's about 200 million folks immunized. That's going to take us a year to get 200 million people immunized.
Ah, okay. My neighbor is an MD on the COVID floor. What would be a nice gift for him and his family? That's a sweet gesture.
Oh, that is very, very nice. If you know what hospital he deliver in pizza or sandwiches. We always loved it when people sent us suddenly sent to our floor or to the emergency department sandwiches or pizza. So that was always
Food
really
always
nice.
works.
Food, all any sort of food always works. I'm trying to think what else. Most of us want a day off. That's what right? That's what most people want. You know, I would say, you know, you might just want to call and see, you know, if his wife or someone, if, you know, if they need anything, just kind of, you know, ask them, hey, you know, do you all need anything, and see what they need. But as far as for him, I mean, food at work always works.
Absolutely.
Yeah.
So I want to go back to this bus thing before we close out, and we're close to closing now. Um, so I was
Yeah.
actually very terrified. I was actually going to take a bus the other day because I was getting my car worked on. And this is in Maryland.
Right.
And they have you now entering from the back instead
Mm-hmm.
of the front. And the bus driver is actually in a nice little protected plexiglass area.
Mm-hmm.
However, there doesn't seem to be any real management of the numbers of people getting on the bus, although they do seem to have most of them seem to have masks. And I was so many people that happened to be on this particular bus that I was completely uncomfortable. So I
Mm-hmm.
decided to take a Uber.
Yes.
So my question is, what protections should Metro riders take? In terms
They ought to require. I mean, I went to a restaurant today that, you know, where I can sit and eat outside. They were very clear: no mask, no service.
yeah,
On the Metro, there needs to be no mask, no service. If you don't have a mask, you know, there's extra mask right here, but no mask, no service.
yeah.
I mean, that's how clear. That's how clear you really have to be, especially with something like a bus where you're, you know, they close the doors of that bus, and you are now dealing with recirculated air. Now,
Mhm.
question: did they have the windows open?
I don't remember. That's a good question. I'll look for that.
Okay.
I don't
Okay.
remember. There were, there. You know, I guess the buses are basically free now, so you don't have any interaction with the driver because you're entering from the rear.
Mm, yeah.
I don't
Yeah.
know who the regulator would be. I mean, they definitely had signs on the bus that said mask required, but people, and most people did, but not all.
Right. Right.
But also it was crowded. I mean, you know,
Yeah.
there were 2 and 3 people to a seat. I mean, it was, you know, people were on the bus. So,
Well, so a couple of things. So since they've been
and
having
you
the
have
Black
one more
Lives Matter,
question.
okay, since they've been having the Black Lives Matter protests that started on March 25th, we've not seen any significant outbreak of COVID from those protests, primarily because they've been wearing masks and it's outside.
Good.
I
No,
think you're not going to see the same thing when we talk about indoor gatherings, right? I think you're going to
like
see
the Trump rally the other day.
like the Trump rally the other day. Exactly. All right. You said one more question?
One more. What hospital did you work in? That was from Alana.
Oh, okay. Actually, I worked at several. I worked at Walter Reed Hospital, the Army Hospital. And then right as COVID broke out, I was working at St. Joe's Hospital in New Hampshire and also at Tohono O'odham Indian Reservation Tribe. They had a hospital in Arizona. And actually, I stopped working there right before. And I'm so happy because I was flying. I was flying, and I'm like, no. They keep calling me. I'm like, no, I can't go back to Arizona until this is over. I can't fly.
Yeah.
So yeah, those were the places that I was working.
All
So I
right.
did what they call locums work, which is where you kind of fill in for doctors that, you know, either need a break or on maternity leave or they're sick themselves. So
Party vibes and hearts for you, Dr. V. People are very excited and glad to have this information. So we will
thank
be
you.
back. It looks like we have answered all of the questions. I don't see any hand raises.
Yep, and I will have the slides tightened up by Thursday because we ran out a little bit of time, and we'll also have the stuff uploaded onto the website by Thursday, so that way people can kind of really reference it. If there's anything that you actually want discussed, when we send you the link to join, just there's a little comment section. You could send it back and say, hey, you know, could you talk about this, or how about this, if you think about something later on, because we really do try to make this your presentation and actually address some of the questions that you have.
Absolutely. And Eva Williams says, thank you so much. And I cannot echo more than what she says. Thank you so much for doing this. We will be back on Thursday at
All
8
righty.
p.m. Eastern Time. And don't forget the website And also, Dr. V is very active on Twitter, so don't forget her on
Yes,
Twitter.
yes,
Uh,
absolutely.
very active on Twitter and following and engaging with people in that space. So that's
Right.
another alternative I don't want to miss. So my mother was an RN
Walter Reed.
at Walter Reed Hospital. Much gratitude. Hearts all around. So thank
All
you,
right.
Dr. V. This has been fantastic, and we'll be back on Thursday.
Okay, thank you.